Now to our first conversation. Health is indeed wealth, as there's an impact of health outcomes on the socioeconomic development of any nation. And healthier populace will bring about a more productive workforce, among other benefits. But what can be done to foster innovative financing models, bridge healthcare financial gaps, and promote both short-term and long-term growth of the sector? Join us now is Damilola Aloba, consumer industry leader at EY West Africa, joining us right here in the studio. Great to have you. Good morning.
Thank you very much, Ladi. Good morning.
Good morning.
Good morning to all our viewers.
Right. And obviously, a healthy workforce is paramount, for any economy. How would you describe, healthcare investment in Nigeria, right now, compared to, say, 10 years ago?
Okay, thank you. I think not much has changed. In the last 10 years, if you look at what the numbers, the statistics have shown, it shows that, the indices have gone even worse. And I'll give you an example. Population in 2011 was about 163 million in Nigeria. Today, in 2021, population has grown by about 50% to about 211 million. What that tells you is that the need for healthcare would increase significantly. However, what you'll also find is that the contribution on healthcare spend as percentage of GDP have not even changed at all. So because at the time, 2011, you find about 3.32%, as against 3.7 in 2021. And again, that's compared to the African Union benchmark of about 9.7%. You can see that that's very far away.
Right.
And then you look at the budgetary allocation by the government at the federal level, and you see that it ranges between 3.7 and 7.5%. But what the benchmark also is saying about 15% from an African Union perspective. So when you look at all of that, you realize that that has contributed to the worsening situations that you find today. You find serious brain drain. Just recently, the Nigerian Medical Association said, the ratio of doctors to patients, about 1 doctor to 10,000 patients.
That's a big,
number. Which is a big number. So the indices, and then the spend itself. When government says they budgeted for the health sector, you find that the spend goes really on the recurrent expenditure. More of it on payment of salaries, managing the ministries, running, training, and all of that. But what actually goes into CAPEX and development of the sector in terms of healthcare infrastructure and all of that is really minimal. So you can see that, again, you've seen, everyone knows about the brain drain that is going on. If the sector was to be in a good condition, you find that people will stay behind and work within the country.
And I've overheard, conversations. Last time I was at a diagnostics place, and the people there were talking about how, some of the best hands, have actually left the country at this time, and it looks like more, might. But it'd be great to change that narrative, at some point. But let's look at private sector participation now in the sector. How would you describe it?
Well, in terms of the actual total spend, private sector in the last couple of years have probably contributed 85% of the entire spend. And this is from the back of, one, out-of-pocket expenses, go to the hospital, bring your money, spend, and also health insurance. Health insurance penetration level, albeit very low, less than 5%. And that also has been the major contributors. It has also been private sector investments by certain sponsors, development finance institutions, private equity, and all of that. So that has been the major role that the private sector is playing. So you can imagine, without the private sector, you imagine where we all be in terms of our healthcare sector.
So what do you think needs to be done, to drive more, private sector participation at this time?
Well, I think the sector needs to be made attractive. One of that is for the regulators of the National Health Insurance Commission scheme to to ensure that penetration level increases considerably. For example, if we move from less than 5% to 20%, what that does is that if I build a hospital, I know that I'm going to get patients that can pay, that can afford to pay for the services. So what's the point of building a 5-star hospital that people come in and they can't afford your services? So if penetration level increases, what you find is that a lot more investment will come into the sector from a private sector standpoint. And also, you find that a lot of, you see, private sector plays a critical role. So the more private sector continues to do its role of, providing those quality services, then a lot more will happen from the government angle, policy-wise, and all of that.
All right. So obviously, inflation has been, the major, talking point, for 2022. Rising prices, food inflation and all of that. But, recently I walked into a pharmacy and I was trying to buy some multivitamins and I found out that the prices have more than doubled, this year. And that's a problem. That's an affordability issue.
Yeah. Yeah, you're right. You see, in the pharmaceutical space, that's another, area that needs to be looked at critically. The reality is that when you look at total pharmaceutical sales in Nigeria today, estimated to be about $2.8 billion. But what's interesting about that is that 70% of that comprises imported drugs. So in as much as you're selling drugs every now and then, 30% is produced locally. And of those that are produced locally, the installed capacity is about 25. Capacity being utilized is actually 25% of that. Now, what that tells you is that when you buy drugs, import drugs, you rely on foreign exchange, dollars, to be able to acquire that. So the pass-through effect of continuing buying drugs, importing drugs, the pass-through effect is what you are seeing, in the rising prices, apart from the fact that there's rising inflation in Nigeria on its own, but the FX pass-through effects, and also the fact that there are critical logistic supply chain issues, which has been factored into prices.
All right. So how can we, achieve self-sufficiency, in pharmaceutical manufacturing? Because if we can achieve that, let's get more percentage of, medicines actually made here, in Nigeria.
Well, I think for that to happen, government needs to create an enabling environment. And what do I mean by that? At the policy level, government needs to ensure that, the policies are right for drugs to be produced locally. And I'll give you an instance. During the COVID period, everyone has been saying that, we rely on the global supply chain and all of that for pharmaceutical production. But what you will find is that when there was a lockdown, China and India, mainly China actually, happens to be the country that provides or supplies all the inputs for pharmaceutical production. So what does that really mean? It means that when there was a lockdown, Nigeria and other countries in Africa couldn't reach China to buy, their inputs. And if you are relying on imported drugs, what that means is that there's a challenge or the risk of drug security. So to that extent, what can we do? Government enabling environment. There needs to be support for those that are producing locally. For example, those that are doing contract manufacturing. Government should ensure that the support from a financing standpoint and the facility they have is adequate to be able to produce a lot more. And then in terms of FX support, it's difficult, but if they still, importing final formulations, they still need FX. So whatever support that can be granted to that to ensure that local production increases considerably, I think we'll be in a good place.
All right. Another big issue, medical tourism.
Oh, yeah, that's something that we all know. When you spend over $1 billion annually on medical tourism, I think it's clear from where we started from, You know, the infrastructure is not there, the enabling environment for doctors to operate, you know. And you find that most of those that travel abroad, many of them they are attended to by Nigerian doctors. So it means that the Nigerian doctors are only looking for that conducive environment, the conducive, the pay, competitive or attractive salaries, and all of that to compensate for the kind of effort and the experience they put in. So medical tourism can only be addressed when you address all the issues I've highlighted earlier, your insurance penetration, making the industry more attractive, ensuring that the spend the government has put into the sector increases to match global standards. I'll give you an example. Nigeria, as of today, we have about 20 million people. Healthcare spend in Nigeria is $84. Healthcare per capita.
Per capita.
Yeah, is $84. Now, if you look at a country like Brazil, who has about 215 million people, healthcare per capita is about $852. You know, dollars. Now, in South Africa, it's about 540. South Africa has about 61 million people. And then Egypt, 105 million and $148. You see that comparatively, those are similar our peers, you know, and we're not doing well at all. So we need to improve all those statistics.
All right. Well, let's look at, you know, getting affordable health care in Nigeria. What's the way forward to actually make that a reality?
Well, the way forward is for there to be more focus on primary health care. And I'll tell you why. You know, the incidence of diseases, the main diseases that we see in Nigeria today, malaria, you know, neonatal diseases, lower respiratory diseases, and all of that, you know, they are found at that elementary level before they get to the, you know, tertiary level. So if there are more primary healthcare centers that have built, you know, at local government level, if local governments can actually begin to roll out primary healthcare centers with support of states and all of that, it will help a lot. And then the basic healthcare provision fund, you know, which the fund has been going into that over the years have declined in the last 3 years. So if government can continue, of course, it's because of dwindling revenue from the side of government,
right.
But if that can also continue and be increased, it will also ensure that affordable healthcare is actually affordable.
Right.
So in terms of affordability, you also need to look at quality of care, you know, which is something that you should go alongside each other. And then the insurance penetration, which from a nationalistic standpoint, everyone at the federal, what is happening right now is the federal government is contributing, the enrollees are not contributing, right. You know, so if
so much
public sector and private sector do.
I guess we all have a part to play. So much to unpack in that industry. Thank you so much, Damilola Aloba, consumer industry leader, EY West Africa. It was great having your perspective on the show.
Thank you very much, Ladi, and nice to be here.
Thank you. All right, so that was the conversation now. So after the break, we'll be crossing over to the National Theatre for the UNWTO conference happening right here in Lagos, Nigeria. That's after the break. Just stay with us. This is Business Morning.